Leon Panetta 2017 lecture series, The Trump Presidency and the Future of America. This lecture discusses the Affordable Care Act, repeal, replace, or gridlock. Ladies and gentlemen, please welcome Sylvia Panetta.
Good evening, everyone. What a wonderful turnout. And it is with great pleasure that I welcome you to the first lecture of the 2017 Leon Panetta Lecture Series as we celebrate our 20th, yes, our 20th anniversary. Time goes by quickly. It really does. I can remember the first one back in 1997. In reaching this milestone, we've presented 80 forums, we have featured hundreds of speakers, and we have hosted thousands of students. We've heard from former presidents, sitting governors, ambassadors, generals, journalists, senators, members of Congress, and many more. For 2 decades, we've held discussions on topics ranging from immigration to terrorism to education, cyber threats, and much more. And each year, we've seen our audience grow and the reach of this program expand. Through television, radio, and the internet broadcast, the ideas discussed at these lectures go well beyond this theater in the Central Coast. In fact, we hear from individuals across the nation and around the globe who value these one-of-a-kind discussions. They share with us their appreciation of a program that steers away from contentious debate and instead brings together diverse points of view in respectful conversations that are thoughtful, comprehensive, and solution-minded. These are exceptional discussions. They are equally parts entertaining and informative, but more importantly, they provide an essential service in our collective responsibility to engage in our democracy. As a government of, by, and for the people, together we make decisions every day about the path our nation will follow. It is our duty to seek out information, to make thoughtful decisions on the best path forward, and then to communicate our opinions to those in elected office. For 20 years, Leon has dedicated this series around that fundamental effort. This spring, we turn our focus to the new administration. The central theme of the last election, as you know, was the American people's desire for change in leadership. Today, the nation is governed by a new kind of president. After just a few months in office, it's clear that his tenure will definitely not be business as usual in Washington. However, serious questions remain about how President Trump will address the key challenges that we face as a nation. How will his policy of America First translate to health care? How will it translate to our economy? How will it translate to foreign policy and to our democracy as a whole? Tonight, our focus is on health care. It was the biggest healthcare system overhaul in American history since Medicare and Medicaid, as you know. Today, the Affordable Care Act has significantly reduced the number of uninsured Americans, but it has done little to address the cost of health care. Further, there are significant concerns about the law's implementation. It's confusing and difficult for many Americans to understand. Some of its changes have resulted in disruption of coverage and an increased burden on employers and the middle class. The new administration has promised to repeal and replace the ACA. But how would this effort take place? The government has never undone a major benefits program after it has taken effect. Think about that. Since its inception, the ACA has grown in popularity, with a post-election poll finding that nearly half of Americans would like to keep or expand the ACA, and only a quarter want it repealed and replaced. What's more, the various parts of the healthcare system that made the development and passage of the ACA so difficult are still present. The healthcare industry remains one of the most influential lobbying organizations in Washington. The political parties are still deeply divided on the best approach to this essential issue, and many Americans now worry about losing what coverage they have. As the president acknowledged, quote, "Nobody knew healthcare could be so complicated," unquote. Tonight, we'll talk with two healthcare policy experts who are both well-versed on this complex but vital issue. Our first guest was the first American of Indian descent to run for president and is considered one of the nation's boldest innovators in the healthcare and education sectors. At 24 years of age, he was named head of Louisiana's Department of Health and Hospitals. He went on to serve as director of the National Bipartisan Commission on the Future of Medicare, and then as Assistant Secretary for the United States Department of Health and Human Services. He was elected to Congress in 2004 and was sworn in as governor of Louisiana in 2008 at the age of 36, making him the youngest sitting governor in the nation. Among other reforms, he implemented a top-to-bottom overhaul and privatization of the state-run charity hospital and the state's healthcare payer systems. In 2015, he announced his candidacy for the Republican nomination for president. He earned degrees in biology and public policy from Brown University. He's a Rhodes Scholar, and he also holds a Master's of Letters degree in politics with an emphasis in health policy from Oxford. Ladies and gentlemen, please welcome Governor Bobby Jindal.
Thank you very much. Thank you. Thank you all very much. Thank you.
Our second guest has been a senior health policy advisor to 6 Democratic presidential campaigns. From 1983 to 1993, he served in the United States Senate as chief health advisor for 3 senators and led major reform efforts in the areas of long-term care, prescription drug coverage, cost containment, and rural health care. As senior health care advisor in the Clinton administration, he was involved in the development, passage, and implementation of bipartisan health reforms, such as the Children's Health Insurance Program, the Health Insurance Portability and Accountability Act, the Prescription Drug User Fee Act, and major Medicare reforms in the Balanced Budget Act. He also served as the healthcare policy advisor to the 2008 Democratic Platform Drafting Committee, as well as co-chair of the 2012 Obama campaign's Healthcare Advisory Committee. In 2013, he joined the Obama administration as Deputy Assistant to the President for Health Policy and Coordinator of Health Reform, helping to implement the Affordable Care Act. He has a BA from Miami University of Ohio and is a healthcare policy consultant in Washington, D.C. Please welcome Chris Jennings. And of course, moderating our discussion is the man who created this lecture series 20 years ago. Please welcome Leon Panetta.
Thank you very much. Thank you. Good evening and welcome to everyone to this, our first forum for this new season. And as Sylvia's pointed out, this is our 20th anniversary. 1997 was our first forum, and that's 20 years. And when you look at those 20 years, an awful lot has happened. We've gone from President Clinton to President Bush, President Obama, and now to President Trump. We've gone from the attacks of 9/11 to the continuing war on terrorism, largely against ISIS, but other groups of terrorists in the Middle East. We've gone from a balanced budget to what is now a record debt in this country of almost $20 trillion. And we've gone from governing, a time when Republicans and Democrats really were working together on issues, to political gridlock in Washington. During that whole time, there's also been this continuing debate in this country about the affordability, accessibility, high costs of health care in this country, and how do we provide decent health care to the American people. 2010, the Affordable Care Act was passed by Democrats in the Congress, no Republicans, and problem it created politically is one that we still live with. Past bills like Medicare and Medicaid were all passed on a bipartisan basis. That was not true for the Affordable Care Act. And the result was it immediately became politically controversial. Had a difficult time in its initial stages in terms of being implemented. Republicans in the House of Representatives voted to repeal the ACA over 50 times. And in addition to all of that, what we saw was a situation where everybody was trying to figure out, how do we deal with this politically? In the campaign of 2016, the decision that faced the American people was, do we repeal the ACA or do we repair it? The election in 2016 was very clear as to who won, and so the result was what we see today, which is the process of moving for repealing the ACA. But in the interim, there obviously has been a lot of concern about how do we ensure that people's coverage is protected. And indeed, people began to worry more about whether or not they would be impacted in terms of the changes that would take place. So the issue that we confront today is the issue of, and frankly, it's going on in the Congress as we speak. They just released the text of the Republican bill in the House that will probably go to markup sometime this week. Do we repeal health care? Do we repeal and repair it or replace it with something? Do we try to correct the problems in the ACA, or do we wind up in gridlock in terms of health care? Those are the issues that we'll be discussing this evening. And in many ways, what happens with this issue will again tell us a lot about the Trump presidency and its impact on the future of America. I'm going to be discussing it with two friends who know health care issues. And as the president said, this is a little more complex than most people thought it would be. And health care is complex. It's complicated. This is not easy to embrace a lot of the issues that are involved in health care. So what I'm going to do is try to talk a little bit in general about health care, and then look at the Affordable Care Act, but look at the different parts of the Affordable Care Act and see if we can at least walk through each of those pieces in an understandable way. Let me begin with the first question, which is, both of you have been involved with healthcare throughout your careers. When you look at healthcare in America, what do you consider are the primary goals that you want to see achieved when it comes to healthcare coverage? Chris?
Well, first of all, Leon, thank you for having us. It is a great joy to be here. I don't have to be in Washington tonight doing an all-nighter to look at the Republicans' work on what they call reform. And it's really a privilege to be here with you in particular, Leon, because you were a great person to work with and for in the Clinton administration, Clinton White House. There is not a better model for a chief of staff than Leon Panetta. And of course, he wouldn't be here without Sylvia. So see, I've learned from you, Leon. Now, health reform. Look, I think when you talk about health care, really people want to do one thing. They want to be able to look at their family members and not have to worry about when they're sick, the prospect of not getting the care they need in a way that bankrupts them. They don't want to have to worry about when they're healing, that they have to think through whether or not their house or their income is going to be substantially threatened. Fundamentally the question is, who are we as Americans? What do we value? I think if you don't have good health in this country, you cannot achieve your highest God-given potential. And that it should be a fundamental right to have access, to have coverage of quality, affordable health care. And that should be the objective of any policymaker, Republican or Democrat. And to do it in a way that's sustainable and affordable. And, my view is that this is not easy. This is not an objective, a goal that can be easily achieved. But fundamentally, it is the objective that we should be all striving for.
Bobby?
Well, I too want to echo, first of all, I want to thank Leon for hosting us. And he truly is, even though both Leon and Chris are from a different political party than I am, I've been a longtime fan of Secretary Panetta for his many, many years of service to our country through multiple administrations. Chris and I...
He worked for Donald Trump, too.
He could indeed.
They haven't called.
There's still time. He's got a lot of time. I also Chris and I have known each other now going back 20 years. It's hard to believe, but he was in the Clinton White House when I was working for the Bro Thomas, the Bipartisan Medicare Commission. And again, I've got a tremendous amount of respect for his knowledge, his experience, and his skills in the healthcare debate. He has always handled himself with integrity and passion for his ideas. We often disagree about policy, but unlike so many of the fights you see in D.C., we can do so and still remain friends and respect each other. Look, I think it's a great question. In terms of our goals for coverage, and I agree with Chris. I've spent a lot of time thinking about, even as a student, about health care. I think health care is a different good from many others in our society. It is a precursor. You can't really enjoy the rest of your life unless you have access to good health care. And I think that our goals for coverage should be what we want for ourselves. I shared this story earlier to a room full of students in this exact venue. My wife and I are blessed. We've got 3 great kids. Our middle child, our oldest son, was born with some heart issues. He needed open heart surgery before he was 3 months old. In that instance, It doesn't matter what gender, what race, what wealth. It doesn't matter. You just want your child to be better. And as a parent, you would do anything. You would trade places with your child if that were an option to restore their health. We were blessed. We had good insurance coverage through my wife's job. We were able to go see great doctors, great surgeons. He's doing great. He's 12 years old. He bugs his older sister, but he's doing great otherwise. He plays soccer, plays sports. He's made a full recovery. He's got a great little scar. It looks like a J. I told him he should tell the girls when he gets older that that's J for Jindal, carved into his chest. That's how brave he was. In that instance, we were blessed that we were able to go to great doctors. To Chris's point, we didn't have to worry about, is this going to bankrupt us, or can we afford to have the surgery? It was life or death. We didn't have a choice. Every family wants that in America. And our goal should have construct a health care system that makes sure that people are able to get health care when they need it. And I think that it shouldn't matter. Health is a great equalizer. When you're sick, you just want to get better. Now, we're going to disagree about how you get there, but I think it's important to remember that we have the same shared goal, which is if it happens to be your child or your parent in that emergency room, you should be able to get the health care that you want. The second component I would add to that, and maybe this begins a little bit of the discussion tonight, is that when my little boy was getting his operation, I wanted the doctors, the nurses to make the decisions. I didn't want somebody from Baltimore and CMS. I didn't want some bureaucrat telling them you can do this or you cannot do that or you must do that. And to me, that's a really important point. And we'll come back to that again and again tonight. But when it comes to coverage, I think everybody should have the ability to get the health care for themselves and their loved ones.
Can I just say that Jay could be Jennings, too?
He doesn't look like you. He's a much more handsome boy. He doesn't look like that.
Okay. Fair enough.
Let me mention, when we look at healthcare, there's been this debate about whether we should do single payer and just forget all this and have the government cover healthcare. There's been the debate about just moving to the private side of the ledger. The reality is, we have to remind ourselves that government-sponsored programs make up 52%. 52% of what we spend on health care, close to $3.2 trillion. Obviously, Medicare and Medicaid make up close to $1 trillion. The VA, veterans, $56 billion. The military, $39 billion. In addition to that, you have programs like CHIP, Indian Health, research, and if you add all of the tax subsidies that are provided to provide health care, you're probably talking about somewhere between 60 to 70% that involve federal dollars. Recognizing that, and recognizing that it's not something you can kind of turn the clock back on. What's the right balance when it comes to health care coverage between what the government ought to cover and what the private sector ought to cover? Yeah.
Well, so it's a great question, and I think, look, certainly the government does pay for a lot of our health care, and if you start including for example, the tax advantage treatment of employer-provided health care, those numbers get really big. The question for me, the way I view it is, all right, I'm not arguing that government shouldn't, again, let me not say this is double negative. I agree that government has a very important role to provide a strong safety net, especially for those that are low income, those with disabilities, those with pre-existing conditions, seniors, and others that are more vulnerable in the marketplace. But there are two things I would add to that. Number one, as somebody who believes in local control, somebody who believes that not every answer has to come from D.C., and as a former governor, by the way, I'd like to see a greater role for our local and state governments as opposed to making all these decisions at the federal level. And so, for example, part of the Republican proposal tonight is going to involve giving states more flexibility on Medicaid. I strongly support that. And I think there are other decisions I think that can be made. What may work for California may not work for Louisiana, and vice versa, and other states. Secondly, even though I think the government's got a very important role in helping to fund some of those safety nets, I don't believe that necessarily should mean that government then has to micromanage how that health care gets delivered. And so one example is in the Medicare program. Yes, the government pays a lot, spends a lot of money for the Medicare beneficiaries and benefits, but we have a growing Medicare Advantage program for seniors who choose that within the Medicare program. They can choose to get their health care delivered through private sector insurance companies. And I think that even in Medicaid, many states have gone to private delivery systems within Medicaid. One of my concerns about Obamacare, in addition to the spending and the taxing, is the role the federal government decided to play in, for example, defining the benefits, regulating the insurance companies, running the exchanges. to me, it was too much government intrusion into how health care is delivered. And so remember, I said when my little boy was having his surgery, I didn't want a bureaucrat leaning over the doctor's shoulder saying, do this, don't do that. And there are countless stories from Medicaid, Medicare, and other government-run programs where there are unintended consequences. Let me close on this point. It's easy as a politician to say, well, I'm just going to fire those bad bureaucrats in Baltimore. I'm going to hire some really good people. Look, these are well-intentioned, hard-working people. I don't imagine they get up every morning thinking, how am I going to mess up health care for millions of Americans across the country? That's not at all what they're doing. But they're coming up with rules that may make sense on average, or may make sense from a distance, or may make sense, in general, but may not account for the fact that every patient's different, that every provider is in a unique position to know the needs of their patient. So to me, the question isn't necessarily, it's not just, I agree that government's getting too big and we need to shrink the size of government, but when it comes to health care, it really is not just what's the government's role in funding health care, what's the government's role in actually micromanaging and interfering with health care, and that's when I want to return that control back to the patient working with their doctors and their providers.
Chris?
I got one fan, that's cool.
So, as Bobby, the governor, will tell you, I'm about to take a counter view here, but I always have to start with a truism, which is that there are too few elected leaders, policymakers, who really know health policy. And Bobby Jindal is one of them. And, it's frustrating sometimes when you get into these rooms and conferences and conversations where really people are going with their gut and not with facts and knowledge. Now, he apparently interprets facts wrongly, but
at least he didn't accuse me of having my own set of facts. That was good. That was a start.
He does know them. What I wanted to say something about this sort of perception of government versus private sector, market versus bureaucratic control, etc. I don't believe in this country we believe in either one. I believe that we believe the role of the government to some extent is to ensure that there's adequate tax credits or subsidies to ensure health care affordable, and that plans who are competing fairly. They're not discriminating against particular populations. And I think that when the governor talks about he likes MA and he likes some of the things going on at the state level with Medicaid, if you look at the Affordable Care Act, it's the same deal. It is private plans being offered as options and choices, living under certain rules that we as a country have decided are important for plans to have to live to compete on the same level playing field. Remember that until 2010, which was the year of the Affordable Care Act, it was the business model of the insurance industry to avoid sick people. If you did not do a good job of that, you would lose in the marketplace. You had to underwrite, or you would lose business, or you would get business, but it would be only sick populations that would cost you so much money that you would have to increase premiums and you could no longer be competitive. That is not, I would argue, the type of marketplace that we want to have. We want to have plans competing on a level playing field in which they are competing on cost and are. And so it isn't a government only. It is government rules, government financing, not government employees giving health care. In fact, I know of no government bureaucrat who on an individual case calls the doctor up and says, don't provide this coverage. There are rules governing how those things work, but it is not one of those cases. I've never seen it in all my years. So I'd like to get past the kind of rhetoric of government only, single payer versus private sector market, because I don't think that's what America is, nor do I think what our system should or will be.
Let's turn to the Affordable Care Act and the elements that make up the Affordable Care Act. And issues that obviously even the president has said we've got to provide some coverage here. But before I get there, Bobby, I want to ask you, when you look at the Affordable Care Act, the reality is that Republicans played a large role in developing the elements of affordable care. If you look at the pieces of the Affordable Care Act, Nixon included that in some of his universal care proposals. We had Bob Dole and Senator Chafee propose almost very similar elements in their alternative to the Clinton health care bill. And then, of course, we had Governor Romney in Massachusetts essentially implement a plan that includes all the elements of the Affordable Care Act. So here are the Republicans supporting a lot of these elements, and today you'd never know it. So how did this become, I mean, it started as a kind of bipartisan approach to health care, and today it's become very partisan. What happened?
Sure, and well, a couple of things. First of all, there is, as we've hinted at before, there's a Republican plan that literally was unveiled today in the House. It'll be marked up later this week. Several times tonight, you may hear us referring to that plan. I want to clarify up front, I offered my own plan and the Secretary was very kind. He talked about the fact that I ran for president, obviously didn't do it very well in trying to stop Mr. Trump back in 2015. I did release a very detailed health care plan that's different in many, many ways from the plan that House Republicans have unveiled today. I just say that by reference to say, as we talk about it, I'm going to explain or sometimes refer to it. That's not necessarily the plan I would have offered. I offered a very different plan. I just want to say that. So in terms of, and I can't, look, the Republican Party is a diverse party. I can't speak for every Republican in this room, much less in the country. But I can tell you my concerns about why I certainly was against the Affordable Care Act from the beginning. And some of the components, I think, one of the reasons I think Republicans have run now consistently in 2010, 12, 14, and 16, and won 3 out of those 4 elections, all promising to repeal Obamacare, and not as a secondary issue, by the way. This was a primary issue. If you go back to the 2014 Senate ads where the Republicans got the Senate back, I bet if you surveyed the candidates, the number one issue that was mentioned again and again was Obamacare, and the number one message was, vote for me, I will repeal it. It wasn't subtle. There was no caveats. There was no repair language. There was no, I'll tinker with it. It was vote for me, and I will get rid of it. In terms of some of the elements that concern us, so let's start at the top with an individual mandate. For many small government conservatives, the idea that the federal government can now tell you under the penalty of the IRS, the federal government can force you to buy a product, that's unprecedented. And we can come back to the ramifications of that because that is a potentially slippery slope. So now if the rationale that sometimes is offered, well, we're paying for your health care, therefore we're not going to let you, if you have a catastrophic accident or a pre-existing condition, we're subsidizing it, therefore you have to be responsible and go buy health care. What's the next step? Well, you know what? We don't like it when you eat all that fast food because it's driving up your health care cost and we're paying for it. What's the next step? We don't like these outdoor activities you're engaging in. They're kind of risky. It's an intrusion on freedom. For us, the idea that the federal government can mandate to you that you've got to go buy something is not something and where does it stop? If the federal government's bailing out, and this sounds like an odd example, but federal government's bailing out automobile companies, maybe we'd like you to buy this brand over that because we got taxpayer dollars that are helping this one. So one, it's not a healthcare specific issue, it's a freedom issue. Many of us worry about the growth of the federal government in having this kind of power, and that's why it was the core of a legal challenge. It wasn't a successful legal challenge, but the core of a legal challenge. Secondly, the growth of the federal government's power, Chris is right. I do see a role of government in regulating the insurance marketplace. I just see a greater role for the states. We've historically allowed many of these decisions to be made by state insurance regulators, not folks in D.C. And so all of a sudden you've got the veneer of private competition, but over time they're going to become the equivalent of regulated public utilities, where you can choose whatever you want, but they're all basically the same. And you're going to have the federal government dictating what the benefits look like, what the profits are. They're getting more involved on the pricing. They're getting more involved in evaluating and controlling these plans. You've got less and less innovation, less and less choice. Third, you've got the Medicaid expansion. So a one-size-fits-all expansion. You took away some of the states' flexibilities that they had before under waivers and other programs. Not even an anti-crowd-out measure, by the way. So in Louisiana, one estimate was for every uninsured person that got covered, more than one person was going to lose their private insurance and go into Medicaid. How does that make sense? So we're covering people that had coverage before with taxpayer dollars in a program that is shown not to be the most effective way of providing health care when you look at outcomes and when you look at accountability. You look at the taxes and the cost. When at a time we've got, as you mentioned, record debt, you've got record dependence growing on government, we're making more and more people dependent on government, raising trillions of dollars of taxes, raising, spending over several years over $1 trillion. So for a lot of fiscal conservatives, it was just adding more to growing government at a time where we had growing numbers of people, record numbers dependent on the government for food stamps, 2 million fewer people in the workforce, and we could go on and on. I will close, though, with one little contrast. Actually, there was somebody who spoke very eloquently in 2008 about health care at least a few times, and that was then Senator Obama when he was running for president. I remember he then told then Senator Clinton that he was against the individual mandate because the issue was affordability. He said it's not that people don't want to buy health care, it's that they can't afford health care. He opposed the Cadillac tax when Senator McCain was for that in that election. He talked about the need to bend down the cost curve. He actually sounded a little bit, in those three statements anyway, at least a little bit like a conservative. That's not how he governed. And so I think the alternative is to be laser focused on reducing costs while providing a strong safety net, providing portability and consumer choice, but to go back, look, I don't want to go back to where we were pre-Obamacare. That's not good enough. The president, then Senator Obama, was exactly right that we've got to bend down cost, and he was right when he told the American people that they should have been able to keep their health care plans and their doctors back then. Unfortunately, that's not what happened. So those are some of, and that's not an exhaustive list, but from a conservative perspective, those are some of the concerns we've got with Obamacare.
So, Chris,
I think it's
how come you came around and supported this Republican plan?
because, Leon, one thing about Democrats, they like to legislate, and they'll do anyone's. They'll even do a Republican plan as long as they can legislate. True. We tried everything else. That's true. And we thought it was a moral imperative to finally address that insurance inequity that I've talked about, which I think it was abominable, and I think the whole public really does, on the existing exclusion discriminations. A couple points, then I'll move on. If you look at the current polling on the Affordable Care Act, of course, it's now suddenly popular to be for the Affordable Care Act. It used to be almost consistently below 50%. Now it's 54%. And it's interesting, it's even higher if you say the Affordable Care Act versus Obamacare. Obamacare, the name Obamacare polls very poorly relative to the Affordable Care Act, which is sort of kind of ironic. But one thing about just a point of clarification, Barack Obama did not support the individual mandate during the campaign for all Americans, but he supported it for parents, for children, and then subsequent to the time he got into office, he found out from CBO and a lot of other sources that you couldn't have the commitment to have the protections for pre-existing conditions unless you had the individual requirement in place. And this is an important point for this audience to understand. There is no politician that I'm aware of, none, who if they didn't have to do an individual requirement, that they would still go ahead and do it. No one, think of any politician who embraces and loves the concept of a mandate. The only reason why they did, the only reason that Mitt Romney did that was if you were going to have the insurance protections in place, you had to make sure that all Americans were purchasing the health care. And the reason why is you cannot tell a private insurer that you must insure someone when they wait until they're on fire and you insure. It's like owning property insurance and saying, my house is on fire, insure me, right? It's not going to happen. So you have to have everyone covered. But if you're going to require people to purchase health care, you have to ensure it's affordable. That's why you have to have tax credits. You have to have a place to purchase it if your employers don't offer it. That's why we have an exchanges. And you have to figure out a way to make it affordable for everyone. That's why we have tax credits and subsidies. So there are 4 pillars that are necessary. Last point. why is Obamacare, why is the Affordable Care Act more popular now? Healthcare is like relationships. You never care about them until you're about ready to lose them. And that's why we're seeing this fear of losing something without really knowing what, if anything, will be replaced by it. Is that are you pulling me?
It says cut off his microphone. I don't know why.
I just think that fundamentally we're seeing now this public saying, wait a second, Congress, why are you rushing through to repeal this before I know what you're doing? And I would say, and I would suggest to the Republican Party, because the one thing I have extraordinary empathy for them. I know how hard this is. I mean, it is really hard to come up with viable health policy. I just have no sympathy or support.
Let me let's go into some of these elements. Universal coverage. We know that at least the rate of uninsured has fallen about 37%. So there are more people that are covered. 22 million have gained coverage under the ACA. As Donald Trump himself said, what we have to do is provide insurance for everybody, because they were concerned about people that might lose coverage in the process of passing some kind of repeal and replace. So I guess my question would be, has the AFA been a success at reducing the number of uninsured? A. And B, to Bobby, can a reform bill provide equal or more universal coverage?
Well, we've seen a decline of the uninsured rate from close to 17, 18% to now 9 to 10% in this country. 22 million people projected for it to be 30 million at the end of this cycle, in this budget cycle. That's coverage. That's not access. There is a word that you'll be hearing in Washington coming out of the Republican Party that says, well, we're providing access to every American. They won't say coverage to every American, they'll say access. Now, if you're a millionaire and you can afford anything and you have access, but if you're at 200% of poverty, which is $24,000 a year in this country, and your subsidy to purchase health care and your cost sharing for it has been eliminated or substantially reduced, you will not be able to afford that coverage. And I suspect the reason why the Republican Party is marking up their bill this Wednesday without Congressional Budget Office scoring is they do not want to show that millions of Americans would lose coverage.
Bobby, you've dealt with health care, and I think you yourself have said that you've got to have a safety net to cover people at the low-income level. Can you do a reform bill that provides universal coverage?
So I think that's actually the wrong metric. And you don't have to go to D.C. to hear that. You can hear it right here today in California. That it's not. Here's my concern. If our metric of success is simply how many people have coverage, what you're going to see is a continuation of the trends we're already seeing in Obamacare or Affordable Care Act, if you prefer that. I didn't realize the president's name is that unpopular, but okay, the Affordable Care Act. You've got higher deductibles, you've got tighter networks. So how meaningful is it to tell somebody, well, you've got a card, but you're not going to be able to actually go see the specialist your child needs, or you're not going to be able to go see a doctor in your community. There are many, many people on Medicaid waiting lists all over this country already, and yes, technically they've got coverage, but the reality is many of them have to drive hours to go see the specialist their kids need, or maybe they're on a waiting list for disability services because it's not their turn yet. And so I think it's a little misleading to only focus on, quote, coverage. I think access is actually broader. It has to be affordable access. I agree. It's not, I think this is a wonderful trap from the left to say, all right, we're going to measure success by how many people, quote, have coverage, and the floor is going to be whatever ACA Obamacare is at today. And anything, if you're one below that, you have failed in your replacement bill. I think that would be an awful trap for Republicans to fall into, because I think we really need to be laser focused on reducing costs. I think we need to make it affordable for people to go and access health care. When you were actually surveyed, when you look at what people were saying back in 2008, 2009, they were saying, hey, I like health care, I just can't afford it. They didn't want to see these massive disruptions we have seen in the healthcare marketplace, millions of people losing access to their plans, many other Americans losing access to their doctors. So I think it can be, and I know the media is going to focus on it. It's an easy number to understand. It's like a box score. It's easy to say, well, it's all about coverage. But I think you have to dig deeper into coverage. What does that really mean? Is it meaningful coverage? Do they really have access to the doctors, the specialists they need? Are they really getting access to the services they need? There have been previous studies, the Oregon study, and I know it's before Obamacare, showing that even before, when you expanded Medicaid, that didn't necessarily result in improvement in physical health care outcomes. So I think coverage can be misleading. I think access is the better measuring stick, and I would hope the Republicans, there are Republicans in D.C. that have fallen for this and said, all right, we've got to cover exactly how many people that Obamacare covered, regardless of whether it means it was good coverage or affordable coverage. I want to go back just to one small point, because I think this is an important one about the bureaucrats not looking over the shoulders. The reality is that's the hallmark of an administered pricing program. And when you get into the ways that Medicaid or fee-for-service Medicare works, what happens, and I've seen this at both levels, what will happen is you set a budget target. Inevitably, they grow beyond those targets. So the first thing that lawmakers or policymakers try to do is you try to cut prices. You try to cut provider prices as much as you can, and we can talk about the history of, the doc fix and all that, and you try to cut provider rates until some point the providers say that's enough. We're paying pennies on the dollar to a lot of Medicaid providers, and at some point they just say, we're not seeing these patients anymore. We try to, but we used to be able to cost shift to the private paying patients, the commercial paying patients. We can't do that anymore, and they opt out, and you see doctors leaving some of these government-run programs. Then the second thing that happens when they can't cut rates anymore, well, they come in with volume caps. And a lot of times these are arbitrary, or at least at best they're based on averages. You look at statewide Medicaid programs all over this country, and you're going to see caps like, well, you can only go to the doctor this many times, or you can only get this many prescriptions filled, or you can only have this many physical therapy visits. And you're beginning to see more and more of that kind of thinking in the government-run fee-for-service part of Medicare, because it's a blunt tool to go in there. And when I talk about bureaucrats interfering between the doctor and the patient, that's what I don't mean the CMS bureaucrat calling my doctor surgeon, but what I do mean is a circular saying, hey, only these patients can get these procedures. And there are thousands of those stories, and I'll be happy to introduce you to those folks who will tell you their lives have been impacted by that. When they were told, you can't get these services because the CMS says you can't have these services. And what I worry about, no, we're not there yet with Obamacare, but what I do worry about is that the evolution of administered pricing, there are going to be budgetary pressures, and that's where when government's paying for and running health care, that's inevitably where we end up, under an administrative pricing system. You cut prices first, and then you cut volume of services.
Leon, I'm about to jump out of my seat. Okay. So, first of all, the so-called Oregon study has been a follow-up study by New England Journal and JAMA, and showing that people in the Medicaid program have actually improved medical outcomes, mortality rates have declined, et cetera. There is this whole issue of access, which I really find to be interesting. When Republicans say that deductibles are too high in Obamacare, or they say access is too little in Medicaid, it's not like they're not saying, therefore, we're going to invest more dollars to ensure there's better coverage or there's higher reimbursement rates to ensure greater access. No, they're proposing a per capita cap that would squeeze down reimbursement from Medicaid. And on an ACA, they're talking about allowing for much less generous benefits would mean much greater and much higher copayments. So I'm sort of at a loss to understand the criticism of either Medicaid or Medicare or ACA about some of the, yes, shortcomings of affordability, but most of those interventions will be a combination of more tax credits to make it more affordable, and generally both, cost containment initiatives, yes, move away from fee-for-service to value purchasing, and now Democrats and Republicans are now sort of aligned in that point. So there is some encouraging developments on sort of how we want to move forward in delivering and paying for health care, and some significant success at constraining costs. Now, you may or may not know this, but two extraordinary achievements that occurred in the Affordable Care Act. One, it was scored by the Congressional Budget Office to be paid for and indeed reduce the deficit, not increase the deficit. No one seems to know that. And number two, actually, since the time of enactment, we've seen a decline in Medicare spending by $400 billion below what CBO had projected at the time of enactment because healthcare costs have slowed in this country. So actually, since the enactment of the Affordable Care Act, the deficit has gone down relative to where it would have been because of some of these policies. Now, there's a whole lot of different reasons why this is the case, but, you know, again, it's really important that when we're diagnosing, or excuse me, when we're prescribing solutions for the problem, we diagnose the problem first and right so that our prescriptions are right on. And I'm a little bit afraid that what we're about to see is going in precisely the wrong direction.
Okay, let's, again, big subject here and a lot of issues to cover, but we're at the midway point here, and I'd like to pause because we're going to turn to your questions from the audience. And I'd first like to recognize our question review team, the people who select these questions and present them to our, help me present them to our speakers. If you'll hold your applause, let me introduce them. They're Chelsea Adami, who's a reporter from the Salinas Californian, Fran Gaver, who's our veteran question review team member, Doug McKnight, who's a reporter for KAZU Radio, and Don Miller, who is the executive editor of the Monterey Herald. If you would thank them for me. We have a group of students that are here representing those who attended this afternoon student program. And by the way, it was terrific. We had about 400 students turn out. Great questions, great interchange with our speakers. What I'd like to do is to have all of the students in the audience, if they would stand, please, and remain standing until I identify each of the schools that they're present with. All right. These students are from the Defense Language Institute, Monterey High, the Navy Postgraduate School, North Monterey County High School, the Pacific Collegiate School, Palma High School, University of California, Santa Cruz. I think that's it. Thank you all. We had a great group of students, as I said, and they attended this program, and all of the students were there because we have generous supporters. The sponsors, the board of directors for the Panetta Institute all sponsored this program, so I would appreciate it if you would thank them as well. All right, I want to cover one more area, and there are a lot to cover here. On the mandates, and you indicated your concerns about the mandates, but I was interested to find that the Heritage Foundation in 1989 said that, and I quote, "There is an implicit contract between households in society that since Americans will care for someone whether or not he or she has insurance, that we should not allow these freeloaders to basically go on without paying." If that's true, I mean, we made a contract in this society that no one is going to go without health care, and we cover individuals, but then obviously somebody has to pick up those costs. If that's true, then why shouldn't we say to them, get coverage?
Well, two things. One, I do think it's true, and I think it says something to Chris's introductory statement. I think it says something great about us as a country, and it says something about how we treat the most vulnerable members, that we are committed, and we should be committed on a bipartisan basis, that we're not going to let people suffer. We're not going to let people, not enjoy access to the health care they need at that most critical and most vulnerable point in their lives. But having said that, that doesn't mean that you have to pick the most, again, rephrase it in a more positive way. You should, even if you're trying to recover those costs, you should do it in the least intrusive way. Why is it that you have to pick a way that involves the federal government mandating people buy a product that they may say that they don't want? So, for example, I think, and again, this is based on news reports. I haven't had time. We've been here all day, so I haven't read the Republican bill. Like Chris, I'm looking forward to doing that. That would be a great all-night read, I'm sure. The Republican proposal that was released today, but one of the concepts they discussed was keeping the pre-existing condition coverage for insurance companies, but then having a penalty for those that don't have continuous coverage, saying, for example, one earlier version said that their premiums could go up, let's say, 40% if they didn't maintain continuous coverage. So the idea would be there's a financial incentive for you to have continuous coverage. Yes, you would still have the ability to get access, and in this case, coverage, even if you didn't and you waited, but there would be a financial penalty. Again, I'm not arguing that there's no role for government, but I'm arguing for the least intrusive form of government. Yes, I want to try to recover those costs, but I don't think that the solution is the government's going to make you go buy something. And the second part of this, and the reason why I think it's so important, we're talking about benefit variability and the rest of it. Look, what's a reasonable policy for two different people in two different circumstances may be different. It may be that Bill Gates can have a higher deductible than you or me, or it may be that at a given point in life you're willing to assume more risk for your day-to-day routine out-of-pocket costs, but you do need catastrophic coverage in case you get, God forbid, you get into a car accident, or you're diagnosed suddenly with cancer. Other people may want more predictability and say, you know what, I really want something closer to first off. Now I know Chris is going to tell me that's the difference between bronze and silver and gold, but I don't think. We've done this before. This is, that's like the government telling you can have any type of meal you want as long as it's one of these three colors or flavors. The reality is there needs to be more variability. What it really comes down to me is, who do you trust? Do you trust the American people to make their own decisions for themselves, or do you think the government has to protect us from ourselves? I'm sorry, I didn't hear the answer. But,
Go ahead. Chris, you want to comment on this? The mandate issue?
Well, first of all, in the Affordable Act, yes, there's platinum, silver, gold, bronze.
So four choices, sorry.
But also within those, plans can modify their benefits accordingly within the actuarial value of those categories. So there are actually, if you go look, and perhaps in your new life you may need to buy insurance, and if you do, you may want to look up healthcare.gov. And
is it working now?
And it's working. It only started working after I left, I think, government. But at any rate, you will find that even within each category of bronze, there's different deductibles, different access to providers, et cetera. So it's a question of not allowing plans to design their benefits to avoid sick people. That's really what we're trying to do, and simplify the choices. But there are still plenty of choices. And any of you who have looked on Covered California, you'll see that. There's an extraordinary number of choices, and they're very different from even within the gold and the silver and the bronze. So I know it's great to say one size fits all and everything, and we only want to sell them black Fords and stuff like that. But no, we have options, we have choices, and I think that competition has helped constrain cost growth. Do we need to do better? Absolutely. Are there areas of the country that have done worse? Clearly. Interestingly, many of who haven't expanded Medicaid do worse in those states than those states who have expanded Medicaid. All these things are really important. Healthcare is a very interconnected dynamic. And woe be to the Republican Party to alter without thinking, because this is not an easy world. And if you want to own the healthcare system and call it now Trump care, that might be something that sounds fun, but as someone who's been defending something called Obamacare, I can tell you it's not as fun as you might think.
Gender care sounds better to me. But
Gender care.
I tried that.
Okay, I'm going to go to some questions. I'm going to ask you to keep your answers as tight as you can, please. It's probably a question for you, Bobby. If states are given more flexibility for managing health care, will guarantees, example, pre-existing conditions, coverage gaps, etc., be protected across state borders? What if a family has to move for work, for instance? Are these differences going to impact on the quality of care?
Sure, great question. So a couple of things. Again, under the Republican plan that was unveiled today, they do keep the guarantee for pre-existing conditions across state borders, even with the additional state flexibility. In the plan that I unveiled, what I did was we made what were called state, now they're being called state innovation grants. They've got different names throughout time, but one of the conditions for states getting those dollars was to show that people with pre-existing conditions and others could have affordable coverage, and we defined that as making sure the plan's premiums weren't greater than a fixed percentage of the median income for a given state. So yes, there would be protections across state lines. One of the things that Republicans have proposed, and I agree with, is allowing competition across state lines. And so, unfortunately, under Obamacare, what you're seeing is more and more counties don't have more than one plan. They've got more and more counties every year now having less and less competition. So this would be one more way to increase the amount of competition and the range of plans offered. But to answer the question, yes, there would be protections for pre-existing conditions across state lines.
Well, I think let's just say the devil's in the details, and we'll have to look at this policy. One of the never-ending, with respect, Republican policy priorities is across state lines. It's like, I don't know, is there anything that you like more than across state line stuff? But
I like saying former President Obama a lot. That really...
Good. Well, I think he looks much better these days. We're in California.
I know. I know where I am.
Hanging curveball. Okay. So one of the problems with this across state lines dynamics is in the Republican world, if you have various different benefits and different rules governing it, insurance commissioners in one state are very concerned about people leaving from one state into another. They have problems, and who's the one who ensures protections for those populations? That's point one. Point two is, guess what? And Bobby knows this deep down. I think he might even acknowledge this, but when you're a plan, a local plan, you negotiate with the local hospital. You get a discount based on the number of patients that you can bring to the table. If you are buying an insurance product in Iowa and you live in Louisiana, there are not many people from Louisiana negotiating for that hospital, so the rates aren't even going to be that low. So the reason why, and this is, by the way, another mythology, is that this isn't even an option in the Affordable Care Act. It is, but the states who have tried have concluded it's a failed option. So in some ways I go back and forth with, should I get really upset about this because I think the policy is so silly, or should I just let it happen because it won't ever really amount to beans anyway? And I go back and forth on this.
I think you should get really upset. I think that'd be good. I think that's...
All right, health care. This is one that obviously is we're all concerned about, is health care costs. Health care costs in general in the U.S. are some of the most expensive in the world, due mostly to the fee-for-service. I think you could add technology and new developments, et cetera, in medicine. How do we reduce costs in general in the healthcare arena?
Well, look, there's several, and this is where I hope the discussion will actually center. And I want to agree with one point that Chris made. Look, healthcare is complicated, and I'm a big proponent of getting rid of Obamacare. I want Republicans in Congress to act without delay, but this is complicated, and I want them to also take the time so that folks can understand the consequences of whatever they're debating, because they are going to own it, whatever they pass. And I think that this is impacting people's lives. And I think you're exactly right. They need to understand what's the implication on the employer-provided marketplace. What's the impact on insurance rolls? What's the impact on Medicaid programs? And I think that you have to approach this with a little bit of humility. And I wish that our predecessors had. One of my biggest criticisms of Obamacare was they tried to do. When you think about it, the individual insurance market's like what, 10%. 10% of the overall insured marketplace, and made all these sweeping reforms. If they'd been really focused on those with pre-existing conditions, it didn't require this massive, massive bill. In terms of lowering cost, there's several things we know, and I think many of these are bipartisan, by the way, that we know we've got to do, and I wish that would be the focus of many of these reforms. We know that better access to preventative and primary care, and I know you're going to tell me Affordable Care Act did it. I don't think that's the way to do it, but I do think better access to preventative care. We spend billions of dollars in each state.
You can keep it and then just call it Trump care.
And when you look at the cost of diabetes, asthma, I mean, there are all these things that we know if we did a better job of preventing on the front end or treating on the front end, you could improve people's lives and save a tremendous amount of money. Secondly, we know that moving towards more accountable delivery of health care, whether that's HSAs for some, whether that's managed care for others, whether there's not one silver bullet, but we know moving away from this just paying for activity, actually measuring and rewarding outcomes. Third, I would argue more transparency on pricing and quality data so that patients and consumers can have access. There's a fascinating little case study down in Oklahoma where one surgical center did this and it actually changed the behavior in the marketplace. For consumers, given today's technology, we should be able to have much better information about how to pick our providers, how much they cost, what their quality is. Right now, we have less information when we do that than we do when we go buy a car or we go buy electronics equipment. Fourth, and we may have less agreement on this, I think we need to do something on lawsuit reforms. Now, California's been ahead of that curve. Louisiana's been ahead of that curve. There have been studies that shows that we could save billions of dollars if we applied some of those same concepts nationally, at least within the programs that are paid for by the federal government, if you want to respect the previous federalism principles. I think that we can help folks organize themselves into organized purchasing pools so they can buy health care. Right now, you have a tremendous advantage if you're buying it through you're buying health care through your employer that you don't get if you're an individual. And I think if we can organize with ERISA-like protections, folks that want to join these voluntary purchasing pools, I think there are benefits there. Within the government programs, I think more flexibility to the states with accountability. I'm a proponent for premium support in Medicare. There's an awful lot of waste in our healthcare system, and it's not just a lot of it is fraud, but it's not just fraud. The fraud a lot of it is because we have a pay and chase program that's designed to process bills quickly, as opposed to actually look at what we're paying for. But fundamentally in healthcare, we've got a system that's evolved almost by accident. I mean, it's not that we sat back and said, all right, what is the healthcare system we would really want if we were designing it today? And as a result, there is a lot of waste and there's a lot of friction between those moving parts. We could spend all day talking about the unintended cost just within Medicaid programs, because we had a program that was designed when institutional care was the dominant way to provide care, and it has not been adequately updated in many ways. It's kind of been bandaged together for community-based care today. So there are a lot of things we could do on disease management and preventative care. Fundamentally, I think you've got to change our tax code. I would argue for our standard deduction. That's probably a bigger discussion we've got for tonight. But I would also think that you'd have to change our legal code so that you can make it easier for people to pool their purchasing power and buy health care. And yes, I'm going to say it every time I can, just to drive up your blood pressure, to buy insurance across state lines.
I took my medications before this.
Chris, while you go at this issue, let me add this question as well. Recently, some products such as the EpiPen and HIV drug have made headlines due to the exponentially expanding prices. Yeah. What can be done about this? What do we do? I mean, both Trump and Bernie Sanders have talked about controlling the price of pharmaceuticals.
And Chuck Grassley and John McCain and a lot of other people on both sides of this. What private insurers will tell you, private and employers in the group market, is that they're seeing that pharmaceutical costs are making up a greater percentage of our overall healthcare spend. They'll tell you it's as much as 20% of their premium, and that over a period of time they're worried about the future, particularly for something called single source drugs that have no competition. It's very, very difficult for the private sector to negotiate discounts if they have nothing to compete with. And so we do pretty well in this country where there's what's called multi-source drug products and generics. When you have a single source and you have an abusive pricing practice by a company, and I think people would argue that the EpiPen was, and the HIV drug products, at least when they were initially introduced, was excessive. I mean, there was an example of a company who they didn't do the innovation around the drug. They bought a company who was going to price a product at $25,000, $30,000, and they ended up buying it and they sold it for $70,000. Well, guess what? That hurts. In fact, the people that hurt the most were Medicaid programs because you got a lot of low-income populations with HIV, so people had to make really tough budgeting decisions. Where we need to go with this is probably more thoughtful ways to do approvals at FDA to get more competition out the marketplace, looking at some of abuses, what are called market exclusivity abuses, where there's an article today where Republicans and Democrats are raising concerns about how orphan drugs who get this extended market exclusivity period, which means no competition in return for developing these drug products, are just slightly innovating around another drug and calling it an orphan drug and then getting multiple years of no competition. That's just totally unacceptable. And there will be a lot more scrutiny. Some people will say all the way to Medicare negotiation, importation approaches. You know, the industry is going to have to be very careful about excesses in this area because the public, even more so than the Affordable Care Act, is getting increasingly concerned about pharmaceutical costs.
Okay, still on health care costs. Every country that has health care for all citizens rations health care. We never hear that in this debate. How can America have affordable health care without addressing this issue? Chris?
Well, look, every time the Republicans are criticizing the Democrats, they call it rationing care, and I suspect later this week we'll hear Democrats saying Republicans through their Medicaid cuts are rationing care because they're giving unrealistic resources to the states to manage coverage for low-income populations. I personally think that rhetoric is it's like death panels. It's sort of like no, yes. If you have no coverage, then you are I mean, let's be honest. If you have no coverage, we're rationing care to people who have no coverage, right? I mean, that's the reality here. We do need to find ways to constrain costs. Do I believe that there's a lot of waste in this healthcare delivery system that we can squeeze out before having those tough conversations? Absolutely. There's no way that we are spending as much as we are in this country and cannot squeeze out much more efficiencies and value out of this healthcare system than we have. So sometimes people enjoy having that conversation because they think it's manly and real and all the rest. But in the end, it just scares people away from getting anything thoughtful or constructive done.
So when the Democrats say this week, you'll be the first to criticize.
No, I'll say they're probably right.
I just want to go back to the previous question real quick, because I think Chris made several good points on the cost of prescription drugs. I think there's an interesting opportunity, and who knows where President Trump will land on this, but as a populist who's spoken out against other countries shifting the cost of developing drugs the cost of developing these new innovative drugs to America, you could say, I'm not saying you will, but you could see some interesting unusual partnerships there. I mean, it could be consistent with some of his rhetoric on trade and some other topics. I think that's worth watching. But I also think Chris is right. If these, and I agree with all, the need for more competition, clearing out the FDA backlog, looking at the unusual alliances between companies sometimes to prevent competition. But I think he's right that these companies have to be careful. EpiPen was just one of the most recent examples. There have been several of these examples. I don't think anybody in America begrudges companies that are developing true innovation, recovering their cost. But I think these abuses, they've got to be very careful. There could be a backlash. And I think the backlash could cause some very bad unintended consequences. What we need to drive down the cost without killing off the innovation. And I think that you're right, that they've got to be very careful with their practices.
Can I just ask that we edit out those remarks that says Chris is right? And then
I would second that. That would be, it's not good for either one of us.
Let me, talking about the costs here. We've talked about this issue of subsidies versus tax credits. It appears that the Republicans are going to put tax credits into their new bill, kind of a fixed amount that will go to everybody on tax credits. So it's not going to be based on income, if I understand it.
It varies based on age.
Based on age. But as some Republicans have attacked it, this is the establishment of a new entitlement in health care. We had the pay-fors in the bill that were there. I guess I don't know whether taxes on medical devices is out now or.
Yeah, it's out.
It was
Pharma
in.
tax out, insurance tax out.
Pharmaceutical sales, high incomes, savings from Medicare. But initially it was designed so that it would be budget neutral. Is that going to be the case with what the Republicans put out?
Yeah, so a couple of things. One, and we were talking about this earlier, Congress, yeah, they love to play these games budget neutral because they have these 10-year windows. Well, they delayed the implementation. They front-loaded some of the subsidies. They don't grow as far, under Obamacare, so they don't grow as fast as medical inflation. So, you can look at that first 10 years and say, okay, it was budget neutral when we passed it. But look, you look at the history of every government program, I think the reality is creating a new entitlement is going to cost us more, and I think you already see the cost pressures within that program. But set that aside. The question was about the Republican plan. I'm not a fan of some of the elements that you've just described in terms of the Republican approach. I think they're going to, and look, this is all based on partial reports, because originally one of the pay-fors was thought they were going to cap the tax exclusion for employer-provided health care. It's seemingly a more, I don't want to say last minute, but a pretty recent change was they took that out of their proposal. So that was up until a few hours ago, everybody thought that was going to be the pay-for. At least from initial reports, it sounds like they're going to delay the repeal of some of those Obamacare taxes by at least another year. And again, I'm not a big fan. I need to understand more and read more about this actual approach. I'm not a big fan of this approach. You are going to have some Republicans on one side that are concerned about refundable tax credits being a backdoor way to get back to the same Obamacare type entitlement program, and their viewpoint's going to be, well, are we just basically creating the same subsidies with a new name, and how does that make it any better? And I'm sympathetic towards that argument. You're going to have others on the other side. They're going to look at the tax credit approach and wonder, unless we're doing exactly as much as Obamacare did, is that enough? I think that's the wrong approach. I think Republicans would be better off starting the conversation by saying, all right, how do we really reduce costs? How do we get at the cost drivers? Because I think if we step back for a second, we've talked a lot, and rightfully our focus has been on quality and access, and I think that's right. As a society, we also need to be cognizant of the fact that healthcare cannot continue growing faster than the rest of our economy. We've been in this for several years now, and it doesn't matter who's president. And yeah, there have been short-term cycles where it's been slower. Maybe that's attributable to the overall economic growth or whatever. But over any reasonable period of time, healthcare continues to be growing faster than the rest of the economy. That puts pressure on state budgets. As a governor, I can tell you that you want to put that next new dollar into education or infrastructure or into tax cuts or whatever your priorities are in the state. But all of your new revenues are being consumed by Medicaid, just by the normal growth of Medicaid. I'm not talking about new enrollees. I'm not talking about new programs. I'm just talking about medical inflation. It puts tremendous pressure on. Most of our states require balanced budgets. They can't print money. They can't borrow money. They've got to make those tough choices. And it's putting pressure on the federal budget as well. And so we've got to have a real focus, a real discussion on how do you cut costs. I do think there's a lot of waste. I think Chris is right. I mean, I think there's some low-hanging fruit. The good news is that there's some stuff that hopefully wouldn't be partisan that we can get done, but we should start there. And I hope that we will put that as a priority in this replacement package. And I think that needs to be one of the first priorities in this replacement package.
Chris?
I'm tired, so you can, unless you want me to.
No, okay. No, not necessarily.
I'll translate. He thinks the Republican approach is bad.
Let me just throw this out for the sake of rationality. We're talking about. The possibility is this bill may very well add money to the deficit, just because we'll have some problems covering all of the costs, or they'll reach it.
I'm sorry to interrupt you. I suspect if it's going to get out of the House, I'd be very surprised if they could get something out of the House that wasn't budget neutral. I just think that there are so many House Republicans that would have a concern with that. If they were counting votes, I just think that'd be. Now, I'm not promising that's what gets out of the Senate, but I would just imagine getting out of the House without. And you would know better than me with the reconciliation rules. That could cause some problems in the Senate if it's not budget neutral. So I may not like the way they're doing it, but I strongly suspect whatever comes out of the House will have a budget neutrality score.
I agree with that. I think that they have to find a way to get just a little bit of savings to meet the reconciliation instructions. The question, though, that we're all scratching our heads tonight is if you reduce the if you add costs by, in essence, eliminating the revenue increasers, whether it was pharma, insurance, high-income people, pushing back the Cadillac tax, all these things, those cost money relative to the baseline. How do you get there? Now, I should just tell you all that for some reason, sometimes, you can explain this to me, that when there's a tax cut, sometimes Republicans don't count that as, costs. But it's a sort of an innovative construct, but it's all in the economic dynamism and stimulative effect. But I'm sorry. I'm sorry.
You asked me to explain it to you. I'm going to explain it to you.
I will. But let me just I promise I'll finish. But I suspect the way they really get to it is they back in some significant Medicaid cuts, through a very, very tight, probably per capita cap. And in the early years, because the tax credits, you eliminate the mandate, you automatically have less people covered. That reduces your costs because you're no longer subsidizing people who purchase health care. And your tax incentives to purchase health care are less than currently is in the Affordable Care Act, so you save money there. So I think it's a combination of those things that gets them to the budget.
Okay. All right, just two definitional things.
Quickly.
Okay. All right, quickly. Just to explain it to him, because he asked me to explain it to him. One, I think it's very interesting when Chris and other Democrats say, well, when we repeal this tax, that's a cost to government. Letting you keep more of your money is not a cost to government. That's letting you keep more of your own money. Secondly, we can.
Bobby, that's like saying you're going to build a wall and send the bill to Mexico. I couldn't resist that. Listen, we're
a very different audience in Louisiana. I trust it. It'll be a very different reaction.
We're close to wrapping up here, but what I want to do is to get from each of you a sense of what's going to happen with this bill. Is it going to make it through the House? Is it going to make it through the Senate? Is it going to get blocked because members are so scared of what the consequences will be that they're not, whether it's Democrats or Republicans, they're not going to vote for it, and we will get no bill? Give me your best guess right now as to whether or not we will see this bill become law.
I think we will. I think that, and look, they're all. If we were laying odds, you could come up with a million reasons why this is going to fail, and I can point to all kinds of groups that are going to be opposed to it on both sides of the spectrum, all kinds of obstacles. The reason I do think that something will get through and get to the president's desk, two things. One, Republicans have been campaigning on this now this is, again, since 2010. This is not just one of many issues they've got to consider. This was a primary issue. Many voters sent them to D.C. And there was a tremendous amount of pressure on those members to get something done. And they believe in this. This is not just political pressure. It's not poll tested. This is one of the reasons they ran for office. They wanted to serve. They oppose Obamacare. Whether you agree with them or not, this is a sincere conviction. And this is something they feel strongly about, and they feel like they've got to deliver. This isn't something like, oh, well, we can compromise on infrastructure, or we can make it. This is something that is a core conviction. When you think of all the new members in Congress, many of them were motivated, the Tea Party revolution forward. Many were motivated to run for office largely due to the protest against Obamacare, the increased amount of government spending and debt. So this is a huge, huge priority so there will be a tremendous amount of pressure to get something done.
So you think they'll walk the line?
Secondly,
even if they have concerns.
The rumors are that President Trump's going to come out later this week, strongly endorse or at least offer some cover. Look, in the first, the first few months of a president from your own party, there's going to be a lot of pressure to work. Now, the final thing I'll say, I do think it's likely something will get done. This is an incredible opportunity, and I think it's too important just to get something done and call it we repealed Obamacare. I think there's a real opportunity to make some very important progress in cutting health care costs and improving access, and that's why I hope we do more than just repeal Obamacare. I hope we actually improve the health care system.
Well, I think that you've got it's a really interesting political challenge, and the governor is correct. You keep on campaigning and running on something, woe be to you if you don't succeed in a primary dynamic. And that's what's really motivating these guys. They really think they have to. Now, if you look at the Republican Party, though, you've got 3 Republican parties. You've got the complete budget hawk Freedom Caucus, who really would just be happy to repeal the thing. You've got the reformers, the philosophical people, and you've got the Republican light. Just get something off the check. I want to do some more popular things, okay? 1, 2, 3. And you've got Republican governors who've expanded, not expanded. Leon's saying hurry up. And so, okay, this is really interesting, though.
What's the bottom line?
Senate, House, Trump. There's a lot of I think the big challenge will be in the Senate. They have 2 votes that they can clear out. And I believe in the end of the day, we'll win.
All right. Thank you. Thank our speakers. Thanks to all of you. This is the first of many issues that we'll be debating throughout this year. And let's all hope our democracy survives.
Great. Good job. Good job. Great. Yeah.